Okay, for this assessment, I will be assessing two major symptoms, the neuro in the eyes, systems, the neuro in the eyes. I've introduced myself to my patient. She has given me two identifiers. She has consent to this assessment. She's oriented ×3, and patient has no known allergies. So first, I will be testing her visual acuity. So there is a Snellen chart 20 feet away. Can you read the Snellen chart?
KLAMNO.
Okay, so she has read it. So her vision is 20/20. I will now be assessing cranial nerve 2. She's going to read each line until she no longer sees it. The near visual newspaper. So read one of those
B,
ones.
C, D, E, G, F.
Okay, so normal near visual acuity 14/14 with no or without corrective lenses. Okay, so now I will be testing the visual fields from 2 feet from my patient with eye level. The patient will cover the left eye. Cover the left eye normal, and then cover the right eye and look at each other. Oh, we're going to look at each other. So I'm going to cover one. We're going to look at each other. Now switch. Oh, and I'm going to, when I come up with my hand, tell me where you see it.
I see it.
Okay, the other one.
I see it.
Okay. So normal peripheral vision, patient sees the same time. Okay, now I'm going to assess the corneal light reflex. With my pen light, 12 inches from my patient's face, I'm going to shine toward the bridge of the nose. The patient stares straight. You stare straight forward, and I'm going to shine it toward the bridge of your nose. Okay, the reflection of the light on the corneas in the same spot on each eye, parallel alignment. I'm going to do the cover-uncover test. So my patient is going to stare straight ahead and cover one of the patient's eyes. I'm going to observe for movement and then do the other eye. So cover that one. Now cover the other one. Okay. The uncovered eye remains fixed. Covered remains fixed. Now I'm going to do the cardinal fields of gaze. So I'm going to hold my object 12 inches from my patient's face and move through 6 positions clockwise. Okay, no extraocular movement. Now I'm going to inspect an external eye cranial nerve 3. I'm going to inspect the eyelids, the eyelashes, the ability to close the eyes. So close your eyes. Okay, eyelids. Note unusual turning, color, swelling, lesions, or discharge. So the lid's margins between the upper margin of the iris and lower lid margin rest on the lower border of the iris. The lids are closed easily. No unusual turning. The eyelashes are evenly distributed, and they curve outward along the lid margin. Now I'm going to observe position and alignment of the eyeball in the socket. So the position, everything's symmetrical. The eyes are in the socket, no protruding. Now I'm going to inspect bulbar conjunctiva and sclera. I'm going to have my patient keep her head straight while the patient looks. I'm going to have you look from side to side, up at the ceiling, down. Okay, it's clear, moist, and smooth. No underlying structures are clearly visible. The sclera is white. Okay, I'm going to inspect the lacrimal apparatus. There's no swelling, no drainage, no redness. Now I'm going to palpate the lacrimal with my gloves. I will have gloves on. Okay. and there's no drainage noted. They're smooth. And now I'm going to inspect the corneal lens. I'm going to shine my light from the side of the eye for an oblique view. Look through the pupil and inspect the lens. Okay, you look straight. Okay. The cornea is transparent with no opacities. The oblique view shows a smooth and overall moist surface. The lenses are free of opacities. I'm going to inspect the iris and the pupil, the shape, color, and iris, and the shape and the measure of the pupil. So, okay, they are flat, evenly covered. The pupil is round with a regular border. Centered in the iris, the pupils are equally 3 centimeters. Okay, I'm going to test the pupillary reaction to light. I'm going to darken the room. Okay, the patient focuses on distant objects, and I'm going to shine the light, the oblique pupil, okay. Okay, you can turn it back on. The pupillary response is constriction 3 to 2 millimeters. Okay, now I'm going to test for accommodation of the pupils. I'm going to hold my pencil 12 inches from my patient's face and focus on the pencil as I move it towards the eye. Okay, the response is constriction in the pupils and coverage of the eyes. Okay, now I'm going to inspect the internal structures of the eye. So I'm going to use my ophthalmoscope and inspect the internal eye and observe the red reflex. Okay. The red reflex is visible. The red area is round and regular with borders. Now I'm going to inspect the optic disc. I'm going to stand very close to the patient, keep my light beam focused on the pupils, move closer to the patient, almost touching the eyelashes. Okay, the optic disc is round and well-defined borders. The disc is creamy and pink, approximately 1.5 millimeters wide. The physiological cup is slightly depressed. Now I'm going to inspect the retinal vessels. Okay, my patient is going to remain in the same position. I'm going to inspect sets of the retinal vessels by following them out of the peripheral of each section of the eye. Note numbers of sets of arterioles and venules, color, diameter, AV ratio. Okay, the 4 sets of arterioles and venules are bright red, progressively narrow. The AV ratio is 2 to 3. They're good. I'm going to inspect the retinal background. My patient is going to remain in the same position. Search retinal background with note color and presence of lesions. Okay, the general background appears consistent in texture. The red-orange color of the background is lighter near the optic disc and no lesions. Now I'm going to inspect the fovea. Remain in the same position. I'm going to shine the light towards the side of the eye and ask the patient to look at the light. Look at the light. Okay. The macula is the darker area. 1 disc diameter and size located at the temporal side of the optic disc within the area is a star-like light reflex called the fovea. Okay, now I'm going to inspect the anterior chamber. My patient's going to remain in the same position. and we're going to rotate the lens wheel slowly. Oh, I'm still okay. I'll be okay. We're going to rotate. Okay. Okay, the anterior chamber is transparent. Okay, now we're going to move on to neuro. So we are going to assess cranial nerve 1. So I'm going to have my patient sit comfortably in a position at eye level, and I'm going to ask her to close her eyes as she occludes one nostril. I'm going to have her smell and identify the objects.
Lemon.
Okay, now could you do the other one?
Cough.
Okay. She identifies the objects correctly. Okay, now we're going to do cranial number 5, the trigeminal. So I'm going to ask my patient to clench teeth while I'm going to palpate the temporal and masseter muscles. Okay. The temperature and masseter muscles contract bilaterally. Okay.
I can't say right.
They contract bilaterally. Okay, now I'm going to test sensory function. I'm going to touch the forehead, cheeks, and chin with a sharp, dull, or soft object. And I'm going to have my patient close their eyes and tell me where I've touched and what I've used. Okay.
Cheek, sharp. Cheek, dull.
Okay.
Chin, sharp.
Okay.
Forehead, sharp. Cheek, soft. Chin, soft.
Okay. The patient has correctly identified sharp, dull stimuli and light touch to the forehead, cheeks, and chin. Now I'm going to test the corneal reflex. I'm going to have my patient look away, and I'm going to touch the cornea with a light wisp of cotton. Okay. She blinks bilaterally. Now I'm going to test cranial number 7, the facial motor function test. So smile, frown, wrinkle the forehead, show the teeth, puff out your cheeks, purse lips, raise your eyebrows, close eyes tightly. Okay. She smiles, she frowns, she wrinkles her forehead, she puffs out her cheeks, purses her lips, raises her eyebrows, and closes eyebrows. Now we're going to do cranial number 8. We're going to do the Weber, Rhine, and whisper test. Okay. First we're going to do the Weber test. So I'm going to strike my tuning fork with the back of my hand, and I'm going to place it in the center of my patient's head and ask if she hears better in one ear, both ears, or same ears. Okay, where do you hear?
Bilateral.
Okay, so she hears in both ears. Now the Rhine test. I'm going to strike my fork, place on the mastoid process, ask the patient to tell me when the sound is no longer heard, move prongs of the fork in front of the auditory canal, and ask the patient if the sound is audible after fork is moved.
No. No.
Okay. The AC is greater than the BC. Now we're going to do the whisper test. Patient converse one ear, and with me behind the patient, I'm going to whisper a 2-syllable word, and we're going to get her to repeat it. Okay, cover. Hot dog.
Hot dog.
Grapefruit.
Grapefruit.
Okay. The patient correctly identifies the whispered words. Now we're going to test the cranial nerve 9 and 10. Okay, we're going to ask the patient to open the mouth and say ah while I use my tongue depressor on the patient's tongue. Okay. The uvula and the soft palate rise bilaterally, symmetrically on phonation. Now I'm going to check the ability to swallow. I'm going to have the patient drink a sip of water. Okay, patient swallows without difficulty, no hoarseness noted. Now we're going to do cranial nerve 11. I'm going to ask my patient to shrug her shoulders against, okay, the symmetric strong contraction of the trapezius muscles. Now I'm going to ask my patient to turn her head against my resistance. Okay. The strong contraction of the sternocleidomastoid muscle on the side of the opposite turned face. Okay, now we're going to do cranial nerve 12. So to assess the strength and mobility of the tongue, I'm going to ask the patient to protrude the tongue, move to each side of the mouth against resistance of the tongue depressor. So, okay. The tongue movement is symmetrical and smooth, and bilateral strength is apparent. Now I'm going to assess the condition and movement of the muscles for the symmetry, strength, and tone. I've noted no tics or tremors when she came in. Now I'm going to evaluate her gait. So I'm going to have you walk across the room for me. Swinging your arms. Okay. Okay. So the patient swings her arms in opposite direction. Now I'm going to have her walk heel to toe and maintain balance.
You hear my knees popping?
I know. Oh my God. Okay, the patient maintains tandem walking, walks on heels and toes with little difficulty. Now we're going to do the Romberg test. The patient's going to stand erect with warm arms to the side. I'm going to have the patients close their eyes for 20 seconds. Okay, the patient stands erect with minimal swaying with both eyes closed. Okay, now I'm going to have the patient stand on one foot and hop.
And hop.
Okay. The patient's knees bend while standing on one foot, hops on each foot without losing balance. Now I'm going to assess the patient's coordination. I'm going to have the finger to nose test. So we're going to have your hands out. You're going to touch one finger to your nose. One finger to your nose. You're going to repeat that 3 times. Okay, my patient touches finger to nose with smooth, accurate movements and little hesitation. Now I'm going to assess the rapid altering movements. So you're going to touch to each finger. Okay, my patient touches each finger with the thumb. Now I'm going to ask my patient to put palms on both hands of knees and turn them up and down. Patient rapidly turns her palms up and down. Now I'm going to perform the heel to shin test. She's going to rub her heel to her shin and do the other one. Okay. The patient is able to run each heel smoothly down. Okay, now we're going to assess light touch. I'm going to ask my patient to close both of her eyes, and I'm going to ask you to tell me where you feel, tell you what and where you feel on your parts of your extremities. If it's soft, sharp. Okay.
Leg, soft. Arm, soft. Arm, sharp. Knee, sharp.
Okay. My patient correctly identifies between dull, sharp, and soft sensations. Now I'm going to test vibratory sensations. I'm going to strike a low-pitched tuning fork on the heel of my hand. Hold the base of the distal radius, middle malleus, and tip of the great toe. Now I'm going to ask the patient to indicate what she feels. Vibration.
No.
Vibration.
Tingly and vibration.
Okay, my patient feels vibration. Okay, I'm going to test sensitivity to position. I'm going to ask my patient to close her eyes. Hold patient's toe or finger, move it up and down. Ask the patient to tell you which direction we're moving.
Up, down, up, down.
Okay, so my patient correctly identifies direction of movement. I'm going to assess tactile discrimination. Okay, with eyes closed, I'm going to test the sterignosis, place a familiar object in the quarter of the hand, and ask the patient to identify what's in the hand.
Cotton ball. Cotton ball.
Oh, this is the quarter. Right.
Quarter. I mean, coin. I'm not that
Okay,
good.
my patient correctly identifies objects. I'm going to test point location. I'm going to briefly touch my patient and ask her to identify the points.
Knee. Knee. Leg. Leg.
Okay, my patient correctly identifies areas that are touched. Now I'm going to test the gravesthesia. I'm going to use a blunt object and trace a number in the palm and ask to identify what I traced.
5. 3.
Okay. My patient identifies the numbers that were written. I'm going to test extinction. Simultaneously, I'm going to touch patient in the same area on both sides of the body and ask my patient to identify the area.
Arm. Cheek. Leg. Shin.
Okay. Now I'm going to test deep tendon reflex. My patient is comfortably sitting in a position. I'm going to ask my patient to partially bend the arm at the elbow with the palm up. I'm going to place my finger over the bicep tendon and strike my thumb with the pointed side.
I think this side.
Okay. Okay, and the elbow extends, triceps contract at 2+. Now I'm going to assess the brachial radius I'm going to flex the elbow with the palm down, hand rests on abdomen or lap, and use the flat side of the hammer to tap the tendon at the radius 2 inches above the wrist. Okay. The flexion and supination of the forearm is good. Okay, the triceps reflex. I'm going to ask my patients to hang her arm freely while support with my non-dominant hand with the elbow flexed. Use the flat side of the hammer to tap the tendon above the olecranon process.
For more dramatic effect.
Okay. Now I'm going to test the patellar reflex. With my patient's legs both hanging freely from side to side, I'm going to use the flat side of the hammer and tap the patella tendon below the patella and repeat. The knee extends and quadriceps muscles contract at a 2+. Now I'm going to assess the Achilles reflex. My patient's legs still hanging, dorsiflex the foot, and I'm going to tap the Achilles tendon with flat side. Okay, the plantar reflex of the foot is a range of 2+. Now I'm going to test the plantar reflex. With the end of the hammer, I'm going to stroke the lateral. Okay, her flexion of her toes occur, and flexion of her toes occur. Now I'm going to test the abdominal reflex. I'm going to lightly stroke the abdomen on each side above and below the umbilicus. Okay. The abdominal muscles contract and the umbilicus deviates towards side being stimulated. That's the end of my assessments today.